Hand hygiene. Can you tell me your name and date of birth?
Hannah Pelham, January 5th, 1995.
Okay, good. I'm going to check her wristband. Looks good. Okay. Today we're going to be doing a head-to-toe assessment, which is just checking all of your body systems and making sure they're working okay. And I already checked her vital signs, so now I'm going to move on to neuro assessment. Going to check for orientation first, so she already told me her name and date of birth. Do you know what time it is?
Around 4 o'clock.
Okay, and do you know where you're at?
The hospital.
Okay, good, that's fine. Now I'm going to do Perla. Give me my flashlight. Okay. Her pupils look equal and they're round, and now I'm going to check if they're reactive to light. That looks good. Okay, now I'm going to do accommodation, so stare at the pin for me. Follow it. Okay, that looks good. So Perla looks good. Okay, and I've already been talking to her, so I know her speech is good. And next is grip strength. So can you grab my fingers and squeeze on them? Good. Okay, and now I want you to just push with your feet like gas pedal. There you go. Okay, so the neuro assessment looks good. Now we're going to go to respiratory, and I would check her breathing effort, but it looks good through the assessment. She's not using any accessory muscles or anything like that. So, and I know her rate is in the normal range. Okay, now I'm going to auscultate. Okay, breathe in. Good. Okay, and her respiratory sounds good. Her lungs don't sound, there's no signs of wheezing or anything like that. Okay, if she were coughing, I would check her cough and her sputum, but she seems to be doing good. Okay, so we're going to move on to cardio. And first I'm going to assess her apical pulse. And I would check this for 60 seconds. Okay, sounds good. Now I'm going to check and see if her radial pulses are bilateral. And they are. Now I'm going to check capillary refill. It's good, it was less than 3 seconds. Now I'm going to check to make sure pedal pulses are bilateral. Okay, good. So cardio seems fine. Now we're going to go to the abdomen. Can you hold that for me? I'm going to inspect to make sure there is no distension. And now I'm going to auscultate all 4 quadrants. I'm going to start in the lower right and make a U shape. Okay, there's signs of sounds present. And I'm going to also palpate the stomach to make sure there's no tenderness, and make sure that it's soft and not tender. I mean firm. Sorry. Is there any tenderness? And it is soft, so her abdomen is good. And now I'm going to check for bowel and bladder. When was the last time that you had a bowel movement?
This morning.
Okay, and can you tell me characteristics, like what color?
Brown, and it was formed and normal.
Okay, and what about your bladder? When's the last time you urinated?
Just like 30 minutes ago.
Okay, and what was the color? Was it clear, yellow?
Kind of in between.
Okay, good. And after this, I would assess the skin, which I've already been doing as I've gone through the assessment. Make sure that skin integrity is good, that temperature is good, moisture, and she seems to be fine. And at the end, I would document my findings.